Good morning, everyone. Now call Professional Registration and Licensing Committee to order. Madam Clerk, please call the roll.
Chairman Coleman.
Here.
Vice Chair Dinkins. Representatives Brown. Cook.
Here.
Davidson. Davis. Dahl. Grier. Kelly. Lewis. Riley. Roberts. Smith. Thomas.
Very good. We do have a quorum, so we are going to start out with executive session. But before we go in, I want to just remind everyone of some of the rules. Last week, we got into a little bit of an issue because we had a caucus meeting that fell right in the middle of our committee. Why they do that, I don't know. But I appreciate everybody's patience for last week. Just want to remind them that we are going to limit everyone to 5 minutes for testimony. If we get into something that we feel we want to go a little bit deeper, that's my prerogative to let that continue to go, but we are going to keep everybody to 5 minutes as much as we can. That goes for questions to our witnesses committee. So if you have a question for everyone here to the witness, that's a 5 minute period, and we will be timing. Once again, if you do have an amendment that you would like to put on a bill, please have that to my office 24 hours in advance so that we make sure that we get everything correct. So with that being said, we will now move into executive. And I move that House Bill 2138 be due pass. Is there any discussion? Yes, Representative Kelly.
I have a committee sub and .02.
Very good. So Representative Kelly has an amendment to our House Bill 2138. Oh, I'm sorry, a House Committee sub. So this is, I apologize. Representative Kelly has a House Committee substitute for House Bill number 2138, ending in .02C to offer, and it has been distributed, and I move for its adoption. Any discussion? You should have a copy. Yes. It's like a book, by the way. Very good. Representative Lewis.
To inquire.
Proceed.
Can you explain the changes in the House Committee sub, please?
So I think it is on page 15. If Representative Smith will all it is doing is adding the reciprocity language so it matches the national language and does not go against the 2020 language that we passed out of the House and out of the Senate in 2020.
Okay. And then are there any concerns with the compact language? With
everything stays intact with the compact. It's just adding that reciprocity language in.
Okay, great. Thank you.
And that begins, I can tell the exact same page. It begins page 14 with sections 345.052. And that reciprocity language ends on page 16, right before 345.170, I believe.
Thank
That's
you.
the only thing that was done.
Any further questions or discussion? Yes, Representative Grier.
To very briefly and publicly thank the bill sponsor and the department for working on this and coming up with the correct language so that we can maintain that license recognition.
Very good. Thank you very much for that recognition. Any further discussion? Seeing none, all those in favor of adopting the substitute signify by saying aye. All opposed, same sign. The ayes have it. You have adopted the substitute. I now move that House Committee substitute for House Bill 2138 be voted due pass. Any discussion? Seeing none, Madam Clerk, please call the roll.
Chairman Coleman,
Aye.
Vice Chair Dinkins, Representative Brown, Cook, Davidson, Davis, Dahl, Grier, Kelly, Lewis, Riley, Roberts, Smith, Thomas.
By your unanimous vote of 13-0, you have voted House Committee Substitute for House Bill number 2138 do pass. That concludes our executive session. We'll move into our regular open hearings. And we will hear, once I get to it, House Bill 2434 by Representative Grier. Well, we'll continue our hearing. I guess I don't know if I'm using the right language. We will continue testimony from last week on Representative Grier's bill. We ended last week with opposition, so we will continue the opposition this morning. So anyone here, let me explain to you what I'm going to do today. We're going to go ahead and take the remaining opposition. I will come back to anyone here that did not testify last week in favor of, and then we'll go to informational purposes only. So anyone here today that did not testify last week in opposition, now is your time. Thank you. If you'll state your name and who you represent, and you do have a witness form, it looks like. I appreciate that. Thank you very much. And if you can make sure the green light is on the platform right there for the microphone. Can you pull that a little closer to your face, please? There you go.
Led team. Ooh, well, they said it was lit. I was like, I don't know. Anyway, I feel this way because I have seen the whole range of nurse practitioners in the time I've been there. I have a nurse practitioner on my team who's worked 20 plus years as a nurse practitioner. Before that, she worked as an ICU nurse and as a floor nurse and as a nursing instructor for 10 years before becoming a nurse practitioner. However, these days, a lot of the nurse practitioners that we have are a year or so out of nursing school. They have very little clinical experience. They decide they want to do this. They don't want to apply and go to medical school, so they do a 2-year, 3-year online program. They maybe do a clinical for a day or two, once a week, weekly for some months, and then they do maybe a 3-month practicum when they're in the office every day for 3 months, and then they license and then they launch. Anybody who brings on a nurse practitioner who's just started, just licensed, knows that they themselves will be taking on being the residency and internship for that nurse practitioner because they have had very, very little clinical experience. I'm quite concerned that there's a move to making them being launched without any supervision. you know that you're going to have a lot of questions, you're going to have a lot of checking, you're going to have a lot of teaching, you're going to have a lot of bringing them along. What we did as doctors, when internship and residency with many levels above us, senior residents, attendings, all sorts of training, guiding us. Nothing was done that wasn't signed off, like in the clinic. They don't have that when they go out, and they barely had any clinical training. So I don't think that the independent practitioner, as a nurse practitioner, is a safe thing for Missourians. Now, I know people are wanting to provide more practitioners for the rural areas, but studies have shown that they don't go to those rural areas by themselves. There's less than, let me see, I want to get the numbers right. Well, in Arizona, where they have independent practitioners, only 11% of them are in rural areas. And so we're not getting provision by approving this. I think of the difference in my clinical experience, and I still felt as a new doctor going out that I needed to talk with my colleagues, check with them, be verified about what I was doing. And, we had over 10,000 clinical hours before we hit practice by ourselves. And these nurse practitioners, as wonderful as they might be, eventually are just neophytes. They get maybe 500 or 1,000 clinical hours. And we see that in some of them who go into these quick clinics, even though they even have a supervisory doctor, because they're unsure. They overprescribe antibiotics, they overprescribe steroids, and then we as primary care physicians are dealing with the fallout of that. So I think of the clinical hours, to be, working in a beauty shop, a cosmetologist, 1,500 hours of practice hours before they go, 1,000 hours or more of clinical psychologists after they've already had their training hours. We don't have any interns or internship or residency for nurse practitioners, and I think we're thinking about launching something that will inevitably cause medical malpractice, will cause injury to patients because of just being not intention, but just being new, not having oversight. I wouldn't have any problems in my 5 minutes.
I'm sorry. Thank you.
That's fine. I just feel passionate about it.
Well,
Okay.
we appreciate you being here. Bear with us for just
All
a
right.
second. Are there any questions for this witness?
To inquire.
Go right ahead.
Now, are you aware that this has taken place already for the last 2 years because of COVID?
Well, there's a lot of things that have taken place because of COVID. I do some telehealth, and all of a sudden for the last couple of years, I can see people in Nebraska, and I can see people in Minnesota, and I can see people in Pennsylvania. And, that doesn't mean that should be the norm when it's not a state of emergency.
Okay, so would there be anything that you would be okay with? Could we come with a compromise? What if we were to just make this where it just affected rural areas?
Well, in some ways, if you're in a rural area and you're in a clinic by yourself, which often if a nurse practitioner is, she still needs a physician oversight, somebody to be calling, somebody to be checking with.
Yeah, I get that.
I don't think that being independent with no hierarchy of checking oversight is a good thing, even in a rural area.
So I still think they do have oversight in there. Yeah, the collaborative practice agreement is still in place that they have. So that still exists.
So what does working independently mean?
Where they don't have to have somebody in that building?
Well, they've had that for a while. I mean, but with a collaborative agreement with people who are there overseeing, checking their
Maybe we
machine.
need more language to strengthen that collaborative agreement that exists to make sure that everybody knows that that's not going away. So there is still oversight, because I do think that there needs to be some oversight. But at the same time, these rural areas need to have somebody in there serving that area.
Well, unfortunately, it's not necessarily the nurse practitioners who are the ones who are there.
I go to a nurse practitioner, and I've always been happy with my nurse practitioner. Thank you.
I didn't say anything about being happy with your nurse practitioner. Yeah.
Thank you. Representative Thomas,
To inquire, please.
proceed.
Good morning. Thank you for being here.
Sure.
Although you may not have any way of knowing this, I'd be curious your thoughts. We frequently hear that, well, they've been doing this for 2 years, but in effect, some rules had been relaxed. But have you changed your practice at all in terms of how you're interacting with your nurse practitioners in these past 2 years?
Well, I don't have any they're just all down the hall from me. They're in my office.
Right. So, but
And
has your
haven't-
practice
we
changed
as a
at all?
medical group have not changed ours.
Okay, and that brings me to the point I wanted to make, that very likely the vast majority of people are the same ones that were in practice before and are still doing the collaborative practice agreement that they were doing pre-COVID. So to try to make implications that, well, this has been happening on a wide-scale basis for 2 years is very likely untrue. So I think most people are still practicing the way they were practicing. So it's very difficult to evaluate because we don't have data. So,
True.
and to the best of your knowledge, like I said, for your own practice, the people that you're interacting with, COVID or no COVID, your interaction, your collaborative practice agreement hasn't changed, hasn't loosened up in the past 2 years. Thank you very much.
Representative Lewis,
To inquire.
proceed.
Thank you. Good morning.
Morning.
Thank you for being here today. And I want to clarify, have you read the bill at all?
I just read a summary of it. I haven't read the bill.
Okay. And I understand a lot going on, but on page 4 at the top, it
Do you have a
specifically
copy for me to look at?
it specifically says talks about collaboration with the physician. That does not go away. What this does is just extends the waivers that the governor had during COVID with the 75 miles, the chart review, and working 1 month with the physician. But for new grads, I understand what you're saying. I'm a RN, BSN. I remember what it was like being a new grad, you know. The RN means now you're a real nurse. And that first 6 months was pretty scary. So if a collaborating physician were to work with a new grad APRN, they could absolutely have their own training program with that clinician. That option exists.
Well, I don't think a month is enough to work independently, to be honest. I mean, we do that with our new people coming in for a month, but I don't think it's enough. I mean, it's enough for the overseeing physician to get a handle on where that person is in their amount of knowledge, but that doesn't, usually in that whole first year or two, there's lots of close interaction and oversight.
Okay, well, great, and thank you for that. And the physician and the APRN, they can decide what works best for them as far as collaboration. It doesn't, they can do for a new grad longer if needed. Thank you.
Right, you can't really afford it longer than that. Basically, as a private practitioner, basically they're seeing people with you, so you're not getting any revenue from them, but you're paying their salary while they're working with you. So you can't really afford it for too many months while you're paying their salary.
Thank you.
Okay.
Thank you. Can I want to ask you a question then, because I'm not sure I understood. Maybe you can help me with this. In your statement before, you said that the 30 days was not enough time, but then just now I think you said that you can't afford to take more time. Mm-hmm. So
what I'm talking about is a whole month, they're not seeing their own patients. They're seeing them with you the whole month. And then after that, they start seeing their own patients but on a much lower schedule and timing than you normally would, like maybe 2 an hour. And then it goes up to more. And during that time, they're working right next to you. So there's a lot of going back and forth, but they're not seeing nobody. I mean, they're not billing or charging or seeing anybody by themselves the first month.
Sure.
But that would be hard to do for like 6 months.
Okay. So let me ask you this question then. You currently have APRNs that you work with, correct?
Yes.
So what was your training schedule like with them?
The nurse practitioner I practiced in Wisconsin for 10 years before I moved down there, and she was already a part of our practice. That's 20 years ago. So she was already fully in the system, as a part of our group before I joined it.
Okay. So if you were to add an APRN in your office, do you have any kind of training schedule set up for what that would look like?
Well, one of my partners has just added somebody, and they're in the midst of that 1 month
Okay.
of just having them go around and seeing and telling what they're doing, and then they will launch into that really reduced schedule for a few months until they feel comfortable ramping it up.
Okay. Thank you very much. I
right.
appreciate it. Thank you for coming in and testifying. Is there any other question for the witness? Yes. Representative, proceed.
Permission to inquire. Go ahead.
Proceed. Yeah, go ahead.
Just a quick question. With the group that you work for, if you would find an issue with your nurse practitioner, would you feel comfortable firing that nurse practitioner with the group that you work for, or would you feel that you should not because there could be fallout for you for sending them down the road, basically?
I'm in a multi-specialty group, so that person would have the same HR process and due process as a provider as anyone else. I mean, it wouldn't be I couldn't just fire them.
Yeah.
But there are certain things somebody could do that you could say, we need to start this process, unless it was something, illegal or something like that, and then would be like,
But do you believe that the organization you work for, they would take your advice if you feel this nurse practitioner is not
progressing in their clinical skills?
If there's issues there.
Yes.
So I know it's your license that's on the line.
Right.
If they make a mistake. My wife's a pharmacist, so I definitely understand that. So, and I know there's certain ones that potentially could be concerned, certain physicians, if they're the organization they're representing really wants that nurse practitioner there. But do you feel that's part of the issue, or is that,
No.
You don't think that's an issue at all?
I don't know in other organizations, but in my organization, I don't see that as an issue.
Okay, so if you'd have an issue, you believe your organization would take action and remove that nurse practitioner off your
right,
agreement.
or put them in some sort of remedial training that would bring them up. I mean, we don't just try and say bye.
Yeah, no,
unless it's really egregious.
Yeah, no, I totally understand. All right, thank you.
Okay.
Thank you, Representative Cook.
Are we done?
I think we're done. Thank you so much for your testimony and being here. Any others in opposition?
Thank you, Mr. Chairman, members of the. Yep, that's the problem. Thank you, Mr. Chairman, members of the committee. David Jackson, registered lobbyist on behalf of the Missouri Dermatological Society and the Missouri Society of Anesthesiologists, here to testify in opposition to House Bill 2434. I want to start off by, recognizing there's a lot of frustration with the physician community on this. I know that a lot of you probably feel like the physicians and our lobbyists have been obstructionists to this issue. You've got access to care issues in your district with not enough doctors there, and CDUS is blocking this movement over the last several years. Representative Lewis and I spoke yesterday, and she, I think, made a good point in talking about how the fight that we have here sometimes that gets pinned as doctors versus nurses is very unique to this building. When you go into hospitals or clinics or doctors' offices, they're working together, they're saving lives, they're treating patients, and they're coordinating care. And I think starting with us, we agree we need to do a better job of listening and make this more about the patients, because that's what this is about. And trying to understand exactly what problems you're having and how we can revamp and retool our statute to try to make that better and increase access to care while also maintaining patient safety. We're here to work with you as a solution, but we also feel that this bill, as drafted, is not that solution. I don't think anybody here is opposed to doctors. I think if your opinion is that a doctor and nurse have the same skill set and that a nurse can do everything a doctor can do, by all means, that's a different view. Vote for this bill. But I think most of you, in talking to you, I think if you could have doctors in your area, you want them. You want doctors to be a part of your care. And I think I want to provide a little context on the background of collaborative practice arrangements and how all this started. In 2008 is the last time we really revamped everything with collaborative practice arrangements. It's whenever prescriptive authority was added to allow nurse practitioners to prescribe Schedule III opioids, narcotics, and certain drugs. And as part of that, everybody came to the agreement that it was appropriate to have a nurse practitioner within a 75-mile radius, or at that time a 50-mile radius, and for them to review charts to make sure that the patient had access to that physician if needed to, and that physician was in line and coordinating care with that nurse practitioner. The 30-day preceptorship was added because that physician's medical license is on the line. Whenever they are lending their license and liability, we didn't think it was a lot to ask for that nurse practitioner to work in the same office as them in order to better understand their practice habits, beyond just what their degree and credentials might be. We heard yesterday that somebody, or last week from a nurse practitioner that, they would, I think, quote, search for the cheapest option available for a collaborating physician. We want them to search for the safest option available out there. These barriers are not barriers for nurses. I want to be clear in that the Missouri Society of Anesthesiologists and one of the clients I'm testifying for are not in collaborative practice arrangements. They have a separate statute. They're here raising the flag telling you, watch out. We want to be careful that bad doctors are not out there signing onto an agreement to allow somebody to prescribe drugs, treat patients without living by the patient and without reviewing any of the charts and just recouping money from it. The economics is not difficult. The doctor gets paid to do a collaborative practice arrangement. But we want teeth in there because the number one priority for us is to make sure that the patient has access to see that physician so they can coordinate the care together. Our concern with this bill is that it eliminates mileage requirements, it eliminates chart reviews for non-controlled substances, and eliminates that 30-day preceptorship. I'm not suggesting that all of those are the best solution, and that's why we're here to come to the table. There are things that have changed since 2008, but our goal is to work with all of you and the stakeholders to make sure there's something that is in place to make sure that the physician is still involved in the care and the patient still have an option to see that physician and work with that physician. Every other issue that we deal with in this building, we talk about facts and data. When we're talking about education issues, we're looking at APR scores, graduation rates, and everything else. The only data we've based this off of so far is that there's no articles about people dying. I would argue there were a lot of people that have died over the last 2 years. I'm not suggesting that's because of nurse practitioners, but I am suggesting that we dig a little deeper and let's look at how many nurses utilize this waiver. Let's look at how many nurses were practicing outside of that 75-mile radius. How many charts were reviewed? And let's look at other states and best practices to come together to figure out a solution that's best for patients.
Thank you, Mr. Jackson. Are there any questions for this witness? Yes.
I want to pick up kind of where you left off, where we ran out of time. So I know for me personally, and probably for most of the committee, we have a real interest in improving access, quality, and reducing the cost of care. And it seems like a lot of these types of bills that we hear in this committee are designed to do exactly that. But as you indicated, on every single bill, we have various groups that come in and testify in opposition. And we always ask questions about, well, why are you opposed? Can you point to anything in particular that shows that this is actually going to harm patients? And all the time, our questions are met with crickets. And that is incredibly frustrating when we have nothing but opposition on these types of bills, but there's no real data to say that this is actually going to hurt people. And you led off with, we all are looking at patients, and that's the focus, is what can we do to help patients. So what I want to know is, when you ran out of time, you were talking about that this does harm patients. So can you share a little bit more about that? You know, we have these types of arrangements in place around the country, is my understanding. It seems like that if there was a great deal of harm coming to patients because of these types of arrangements, there would be data available. So what data do you have that shows that this does cause harm to patients?
Yeah, and I want to be clear in that our number one focus, again, is making sure the patient has the option to have their physician involved in their care. And I think, I'm not going to, try to use scare tactics to tell the committee that everybody's going to die if this bill passes. What I am suggesting, if you look at the data to show, if you look at medical malpractice claims data, the highest malpractice claims against nurses are related to diagnosis and medication and treatment of care. Now, do doctors make mistakes? Absolutely. But if you look at those malpractice and claims data, all of this best practices show that the best way to increase patient safety is to collaborate care, documentation, so you have common knowledge among all the providers about medication involved. And we're looking right now at most of this focus has been about primary care. But this bill is drafted could allow somebody to open up a women's health practice and, start mixing with medications while somebody's pregnant. You could have somebody diagnosing cancer. You could have, I think if anybody on this committee has somebody in their family who, may be treating or dealing with cancer or serious illness, may want the doctor involved. If you have a kid who is on a college campus getting, prescribed depression medication, you probably want that doctor involved in some case, not necessarily on campus, but involved in the care. And I think what I'm suggesting, I don't have all the answers, and this isn't a gotcha thing where I have data, on every aspect of it. What I'm asking is that we scale this back and look at whenever in 2008 we passed all of this, we heard the same arguments. This is going to increase access to care with prescriptive authority. When we amended it to allow, telehealth remotely, we heard the same thing. When we talked about a 28-day waiver under the mileage requirement that's also been amended, we heard the same thing. But one thing I would like to see in this bill is some reporting mechanisms, statistics, so we have some things to base this off of as we make our decisions and not just make it based off emotion.
Thank you, sir.
Thank you, Representative. Any further questions? I'll come back to you, Representative Dahl. Representative Kelly,
To inquire.
proceed.
What can you kind of go over, and maybe you don't know, I don't know, when a collaboration takes place and when it's a distance collaboration, how does that collaboration take place?
Yeah, it's a good question. And I think also a question that would be interesting to find data. Maybe this data is out there, regarding how many nurse practitioners are in collaborative practice arrangements that aren't in an office with the collaborating physician. But to your question, right now, a physician is required by law to review 10% of the charts for patients, and it's increased to, I can't remember, it's 15 or 20% when it involves controlled substances. However, the doctors that I talk to that's closer to 100% that they're reviewing. If you have a doctor who complains about this being a pain, that they don't want to deal with the charts, we don't want that doctor collaborating, in our opinion. This is a consumer protection issue for us. Now, I also think that, as you and I discussed, chart reviews may not be the best option, and we're willing to consider that and look at what's changed. I actually think that the gentleman that testified from Chestnut Health in last week's hearing and talking about kind of a peer review process and sharing patient, interactions, over telehealth and looking at things may be a good addition to consider. And I think we need to look at those best practices. But the different physicians and nurse collaborators do it different ways. Some physicians are in the clinic, at times. Some of them, are practicing remotely the entire time. But there is a collaboration, and it's designed for the physician to be involved with that patient's care and for that patient to have the option to see the physician. I don't know if that answers your question.
Well, so when chart review takes place, is it through the computer? Because they all enter their documents online now. And so all that takes place online, correct?
Yeah, it's through electronic medical records. And I think we do have one more physician here who's going to testify who might be able to speak a little bit more to that. But again, I'm not a physician, but from my understanding, if a nurse practitioner sees a patient, enters it into the medical record, then the physician is required to go back into that record and sign off. Now, I have heard from some doctors who say it's, it can be bureaucratic, not because they don't want to do it, but because when they enter in the system and shoot it in, it can be a black box. Now, that may be an organizational issue, right, that they need to figure out. Maybe some practices have figured it out better than others. But I think it's something we need to look at when I talk about, coming to the table and retooling all of this to make sure it's best practices. I think that's something we need to consider.
But that same collaboration could take place in that same building too, right?
Correct.
Where they're not talking face to face, it's all electronic.
Correct.
Okay, thank you.
Thank you very much, Representative. I will just state that, just make clarification. Every 14 days, 20% of the files need to be reviewed for controlled substances. So,
in this bill, to be very clear, this bill does not touch the controlled substance portion of those chart reviews. That is left intact. Now, we are concerned about a physician being, if you have a physician in Joplin who's supervising, a nurse practitioner in Hannibal who's prescribing controlled substances, even if they're reviewing that percentage of the charts and they're nowhere, and that patient doesn't have the access to see that physician, that is concerning to us.
Representative Dahl, proceed.
So I appreciate your willingness to work on this. I guess my question is, we heard testimony, I think it was last week, and I believe it was on this bill, that said doctors aren't actually reviewing these charts. And I know you said your doctors do, but we know that there's a lot that aren't bothering. They might have to sign off on it, but they're not spending, hours of their time. They're busy, right? I get it. So I guess my question for you is, do you have thoughts on what a better way would be to still have that collaboration and some oversight, but to not have the burden of chart reviews that is it? I mean, no one's monitoring to see if a doctor is actually doing that, right?
Yeah, it's a good question. And that's where I think, when we talk about turf wars in this, and I know there's a perception that this is doctors trying to protect their money. I want to go back to the point that a doctor gets paid to be in a collaborative practice arrangement. So the doctors that, if you have a nurse practitioner who's saying they can't find a doctor to collaborate with them, I think we need to look closely. If you have, 15 doctors in a metro area that aren't comfortable putting their liability on the line to get paid for that collaboration, is patient safety something we should consider? But, to your question, I think we do not stand behind any physician who doesn't want to review charts or have that oversight. In our opinion, those doctors should not be in collaborative practice arrangements, and if they're not following the statutory guidelines, they should be disciplined by the Board of Healing Arts, and we'd be the first to file those complaints. We think that's an accountability measure and a patient safety matter. Now, is there more, a better way to do that? Maybe you have the physician on site working and doing face-to-face review or collaboration on charts with or medical records with the patient with the collaborating nurse practitioner. Maybe there's things we can utilize through telehealth. Maybe we can look at something like they do in Illinois. I don't have all those answers, but we're willing to roll up our sleeves and try to find those answers. We just think that if doctors aren't filling out chart reviews, the answer is not to get rid of them. It's to find a better solution to keep physicians engaged.
What do they do in Illinois? I'm curious.
So the gentleman who testified with Chestnut Health, if I understood correctly, they have, I can't remember the frequency, maybe monthly, maybe even weekly, where a physician is over telehealth with them, reviewing different patient cases and scenarios and patterns of behavior, if I'm repeating that accurately. I can't speak to the effectiveness of it. I think let's look at ratings there versus here and kind of look at the data. I don't know, but that could be a solution.
Gotcha. Okay, thank you.
Thank you. Quickly, how many more people are here to testify in opposition? One. Any other folks here to testify in favor of that did not testify last week? Okay, so, all right, we're going to go with one more question here, Representative Davidson, and then we're going to move on to the next witness.
I believe you touched on this already. There is a liability that a physician carries, though, in each collaborative practice that they enter into, even if it's the nurse or the physician, the PA who actually practices, I guess, the malpractice. Is that correct?
Yeah, so there is a liability in the physician's license and medical license that's on the line. If you have somebody who opens up a pain clinic and is prescribing opioids and there's a claim, that doctor is going to be included in that claim, and they have liability affiliated with that.
Could you share why you think that liability isn't enough to promote healthy collaborative practice between physicians? And
I wish it was representative, but for when I hear from and talking to doctors, you will hear it's kind of a common theme where there will be a nurse practitioner shopping around offering to pay a physician and hire the cheapest one. There's websites how to hire the cheapest collaborating physician, and there are some doctors who are willing to roll the dice and say, if I don't have to do much and I just have to in this case sign off on some charts under current law or maybe no charts and roll the dice and get a retainer every month for it, I'll roll the dice. And that's something that we don't think is in the best interest of patients, because when patients, this is an area, I'm all for getting rid of regulations and barriers, but when patients go into a healthcare setting, they trust that somebody vetted that person, is qualified, and there's a physician involved in that care, and that group is this committee. And so I think we need to be really careful before we change these laws.
thank you.
Thank you, Mr. Jackson. I believe that if I'm speaking correctly, that you have agreed, along with the bill sponsor, to meet sometime next week.
Yes.
To try to come up with some solutions. So I appreciate your efforts on that.
Representative Lewis, I'll follow up with you. I know you had a question. Happy to.
Thank you. Next one up for opposition. And let's try to keep it, I hate to do this to you, anybody that comes up to testify in opposition, if we can keep the comments to a minimum for new comments, because we are running into time restraints for the next bill.
Thank you. I'm George Hubble. I'm an obstetrician gynecologist. I herald from the Lake area. Dr. Thomas is the representative of my fair and fine district. I want to just kind of qualify my own appreciation for having nurse practitioners in my practice for over 3 decades. I've had serially, I've had 2 have retired. I have one actually that was my age in my most latest part of my practice, and so the value and the things that they provide for my patients and my practice is enormous, and I have all respect for them. I continue, and in my last 3 decades of practice, I've trained, I've preceptored, I've gone through didactics with nurse practitioner candidates, so I feel like I'm versed to talk to you today or to answer your questions. Curiously, of all the nurse practitioners I've worked with, and this is anecdotal, when I query them, would you like to be independent? Flat answer, no. I've never had anybody tell me they want to be independent for a number of reasons. I think they know that the practice of medicine is a team at this stage, and we're, as a physician, we're the captains, and there are a lot of practitioners et al. Under us, whether that be a PA, whether that be a nurse practitioner, various people in mid-level categories. To relegate someone to not have regulation, who heretofore has been educated and as well only experienced being dependent upon a collaborating physician, I think is a large step. There are a couple things that I think that really we haven't really mentioned, and that would be in a physical sense. I think the physical note on this bill is $0. I would vehemently disagree. When you're an independent practitioner as a family practice doctor or a rural physician, a general practitioner, your insurance runs about $6,000 to $10,000 a year. So I think you could do the math and see that anybody that wants to be independent in the nurse and the APRN category, would be faced with insurance, or the system or the corporate entity that employs them would be faced with insurance. And you can do the math. There are quite a few thousand of practitioners in our state. Additionally, to have a new category of independent APRN, in my mind, and I think probably in the legislature's mind, and certainly the Department of Health and Senior Services, would require someone to have a review board. At present, there is no review board. They're under the division of the nursing board. Unlike PAs, unlike MDs, unlike DOs, unlike assistant physicians, they're all under the State Board of Hearing Arts, where any complaint, any malpractice filing is 100% review. And I think that really does keep or safeguard and keep our state safe. Our Board of Hearing Arts, I know, review over 1,000 complaints and cases that have been filed for malpractice and involve, if your name's on the case, you're going to have your day in Jeff City. So I think to set up a board like that would definitely have some physical consequences. And if you are trying to be parsimonious with the state's dollars, it is not going to be a $0 physical situation. Finally, I think Dr. Kiefer alluded to this earlier, but we're fortunate to have an assistant physician category of practitioner in this state, and we're unique. I think 5 or maybe 6 states now have that, whereby somebody goes through their entire graduate medical education. They're an MD, they're a DO, but they haven't done a residency for whatever reason, and then they decide they want to practice. Well, unless you can go back and get into a residency, you are a tweener. And in this state, we've allowed collaborative agreements under a licensed physician to occur, which has been a very successful program. We probably have 100 physicians now in the state that are practicing as assistant physicians. So the assistant physician has 10,000 hours of training, and yet they're under collaboration and chart review. We're talking about taking a practitioner who has 500 hours, or 1,000 if they're a doctor of nursing, those are the requirements of clinical training, and propelling them into independent fashion, yet we have an assistant physician category that does not allow that. So I think, again, they're not tantamount, but again, we're opening up a can of worms if we make these practitioners independent. I probably yield my time.
Thank you. I apologize. I wish we didn't have these time restraints, but unfortunately we do. So I appreciate your testimony. And is there any questions? Yes, Representative Davidson.
Would you please define really quick what you mean by independent?
By independent, no one, making medical decisions without, on de novo on their own, without oversight. Again, if you restrict and you let someone come out with 500 hours of training, and I'm sure there are corporate medical entities that would allow such, they would not be under the guise of any higher order caregiver.
Does a collaborative agreement, though, then preclude that arrangement? I mean, doesn't it sort of negate that? Isn't there some sort of supervisory role?
Yeah, as a collaborator for 30 years, I reviewed 100% of my charts with my nurse practitioners.
And
I continue to.
And this wouldn't prevent you from doing that either. Correct?
Doesn't prevent.
In
no,
fact, it still requires.
But it doesn't. It doesn't require.
So it's still
all of a sudden there would not be a requirement for any review.
I think it does require, though, that APRNs do enter into collaborative agreements in order.
Collaborative agreement, but chart review. does not require any. So you can't see if someone is off the mark. You can't evaluate whether someone is.
Well, no, but a physician could do all of those things. It doesn't prevent them from doing any of
It doesn't
those.
prevent that, but it doesn't
Excellent.
mandate.
Well, it mandates a collaborative agreement and then leaves up to the risk averseness regarding liability of the physician to determine how best to exercise that collaborative
Right.
agreement.
I
and
can
exercise
give you
that
an example in
supervisory
my
role.
discipline.
Mm-hmm.
And maybe this is a little extraneous, but just the same. There is a practitioner in this state, a lay midwife or a certified professional midwife that heretofore did not practice until about 2007 or so.
Yeah.
And they are independent practitioners. They are not required to collaborate. They are not required to have chart review. There is no review board to review malpractice, acts of omission, acts of commission. They really don't have any review. I can tell you I've been the de facto chair of the Maternal Mortality Committee reviewing every maternal death in this state since 1999. And I've done the due diligence on this, and I've looked at what has happened since institution or whatever, relaxation in that requirement to allow lay midwives practice in our state, have home deliveries, and not any regulation or any collaboration because they can't find collaborators.
Yeah.
Now, the infant mortality, the fetal mortality rate is 20 times higher when somebody delivers at home in this state.
Yeah.
The maternal mortality is over 3 times as high in that category of person who's doing a home delivery with a lay midwife.
I guess what I would say is you make good points, and that's a reason not to get rid of collaborative practice altogether. I'm considering the legislation, though, not in the context of creating independent APRNs, rather collaborative agreements between physicians and APRNs that is more locally managed to that particular circumstance. Appreciate your answers. Thank you.
Yeah, again, the local issue, though, I don't think anybody really has a true issue with the realm or the size or the radius of coverage for that collaboration. It's, I think, 75 miles now, if I'm not mistaken. And, I know there was testimony last week about being 76 miles away and having to, per case by case, get a voice order to see a patient. I think those are things, Representative Kelly, that could probably be relaxed and have a friendlier, more collaborative, less burdensome situation.
Thank you for your testimony, sir. Again, I would love to take questions, but real brief.
Thank you. I just wanted to say I'm going to be posting on the witness forms some testimony from Mark Terramarina, who is a physician, a GI physician, many, many years in practice. I know that you're well familiar with him. He's on the Board of Healing Arts, and he is in opposition to this bill. And his experience with mid-level practitioners and nurse practitioners in particular, with some suggestions on how this bill could be adjusted. But I would just encourage people to go look for that. I'll get it online. I didn't know how to do that because he sent this to me. So I will post this under with his information under witness testimony. So thank you very much.
Thank you, Representative. Okay, thank you very much for your testimony, sir. Again, due to our time restrictions, if there is there anybody that is here from out of town that is in opposition to this bill? Okay. I hate to say this, but quickly, for those who are here from out of town that are in favor of this bill, come on up and if you can keep it down as much as you can. I apologize. I know this is an important issue, but unfortunately we don't have the time that we used to have. So we appreciate you being here.
You're fine. I'll talk quick. My name is Susan Klotz. I'm a nurse practitioner in Ash Grove, Missouri. And as a result of the emergency waiver that was put in place in March of 2020, when I lost my position at Mercy for COVID saving measures, it left numerous amounts of my patients with special needs and disabilities without care, without the care that they need for quality of life and function and to maintain. So I was able to start my own practice independently. I do have a collaborating physician during this time, who I was able to arrange out of Columbia, which would have been past that 75-mile waiver. So, you know, without this waiver, I would not have been able to acquire somebody for me to be able to start this practice. Within 2 weeks of me losing my position at Mercy, I had a patient pass away from intrathecal backlift withdrawal, which is life-threatening, but it's not a well-known treatment, and that's a treatment that I provide. I work in physiatry, which is physical medicine and rehab. And in the Springfield area, it's a very limited specialty. And I think there's a total of 9 physicians that are able to, that would be adequate collaboration under the current statutes. 7 of those are in non-compete clauses and are not able to collaborate with me because I'm an independent practitioner. So that leaves me with the options of hiring from a physician collaborative group, which are headhunters. They contact you and say, hey, we have a collaborating physician. Now that physician may be in pain management, but may have never touched a backlift and pump. So, you know, not having this waiver in place really limits my ability to care for these patients. I do 98% of my practice as house calls. There's a huge strain on our system right now as a result of COVID, and I think we're going to continue, even if COVID's under control, we're going to continue to see the fallout from that. So for us to go to the doctor, we get up, we get dressed, we take off work, we make sure we get there. For one of my patients, it takes a nurse, it takes a guardian, it takes special transportation to get their wheelchair into their van, it takes special accommodations. Okay, talk quick. And so you have a high, rescheduling rate for patients, which puts a strain on the medical facility. You have staff that are paid to take care of them during that appointment time, and they can't come. So I feel like the 280 some patients that I have, that I'm able to go out and see them in their homes, that I'm able to be available to them 24/7, that I'm able to provide safe, adequate care for them. It's monumental, and I think that the 75-mile barrier rule is the hardest thing for me to be able to get along with when it comes to being able to provide care for my patients. Because those that need it the most are the ones that I'm going to have to tell, you're going to have to come into the office, and that's a 2 to 4 hour trip for them. That's a day off work. That's a lot of sores. That's a lot of pain, and that's a lot of spasticity for a 15-minute procedure. So I get the concerns. I'm a practitioner. I remember what it was like being brand new. And I think that the key word there is collaboration. We have a relationship with a physician. We just don't have the checkbox requirements for that physician to work under. And honestly, when I first started practice, my physician did review 10% of my charts. He did it in writing. In the past 2 years, my collaborator hasn't reviewed my charts. Doesn't mean we haven't communicated, just means he hasn't had to open charts to review them.
Very good. Thank you.
You're welcome.
Because of time restrictions, I'm going to go without any questions at this point in time. I appreciate your testimony. Thank you very much for driving to the Capitol. We appreciate you being here. There is one other that is in favor of. Come on up. Okay.
I'm David Winton. I would be very brief because I know you all have other things to do.
Thank you, sir.
I wanted to make 3 very quick points. The first point is that we talk a lot in this building, and we're all friends back here, so we all have worked on this. This has been going on for over 10 years, probably further back than that, in earnest. And when we do these bills, we talk a lot about the physician being able to figure out what the right thing to do is based on their scope of practice and their ability in the field. When we passed a telehealth bill 4 years ago, all of us together said you should be able to provide services vis-a-vis telehealth if it's in your scope of practice and you can maintain a standard of care. We trust physicians to do that. All this bill says is that we're going to trust the physician collaborator to come up with an agreement with that nurse practitioner to be able to do that work. That physician has gone through medical school. They're exceptionally smart people, and they know their license is exposed. They will take the necessary precautions that they think. And the third point I wanted to make was, so you all wanted some data. So Cox Hospital, I'm Dave Winton here representing Cox Hospital and BJC. For Cox Hospital alone, we had 1,000 referrals over the last year and a half made to home health agencies by nurse practitioners because we had this waiver. That is 1,000 people that were getting care that they needed in an efficient way through a system that may have had a much more difficult time getting that care if it required a physician's order at that point. So I think that's a pretty astounding data piece. But this bill is not independent practice. It's not earth-shattering. Most other states around the country have done this and well beyond and have not seen any ill effects out of that. Mr. Chairman, thank you.
Thank you for your testimony. That being said, anybody here to witness in informational only? Seeing none, that will conclude our hearing today for this bill. No, we're good. Thank you for your time. Is there anybody else here? No, well, we asked opposition earlier. I apologize. We will be coming back together on this bill, so this is not the end. We will have an additional hearing. We have to get on to the next bill, and I apologize. Thank you very much for those who feel like I let them down. I apologize, but time restraints keep me on track. So we are now moving into hearing on House Bill 2050, sponsored by Rep. Shore. Mr. Sponsor, it's yours. We are going, just first of all, how many here are here to testify for and against on this bill? Okay, so here's what we're going to do, because again, we have less than an hour to get this done. Because this is like the 300th time we've heard this bill, we're going to keep everything to a very minimal witnessing. We're going to go to 2.5 minutes for every witness. So make sure and let's keep everything. Let's not regurgitate what has just been said, if we could, please.
Thank you, Mr. Chair. As you stated before, this is the fourth, fifth, I think I've lost track, maybe sixth year that we've heard this. I know this committee has heard the exact same bill, exact same language last year. For the record, I am Nick Schroer, House District 107, home to the Waylon Jennings Memorial Highway, and I am here for House Bill 2050. As I've indicated, it's the same bill as House Bill 500 from last year. This is an optional license for individuals partaking in the mechanical contractor field. This is, again, the exact same language that we had last year. You know, we were talking about the licensing just a minute ago, and imagine if a physician or a doctor, nurse practitioner would have to obtain, despite all of their training, they would have to obtain an individual license for each patient that they would see, depending on what county they were in. St. Louis County, you get a new patient. St. Charles County, you get a new patient, or you get a new license. So what this is trying to do is prohibit the duplicative licensing requirements. Hopefully this year, and seeing what the Senate is doing right now, I have hope that maybe we can come together and figure out a way to at least get a piece of this pie passed this year to help these individuals that are their counties and political subdivisions are reaching into their pockets to pad their coffers, so to speak. So I'll open it up again. I will state that this sub is going to carve out a couple exceptions in the propane field and the sprinkler fitters field as well, just as the Senate bill did. I think it was Senator Schatz had a carve out for those. We're going to include those in a sub moving forward, and I will take any questions.
Thank you, Representative. Again, we're going to keep these questions to a minimum, but if you do have a quick question, seeing none, thank you very much. We're going to alternate back and forth because of the number of people here. So we're going to start off with someone that's here in favor of this bill. If you would please state your name and who you represent, and did you fill out a witness form as well?
Yes, sir.
Okay, thank you.
I'll start my clock as well. My name is Kyle Martin. I'm from Winona, whopping population of 1,300, about 3 hours south of here. I represent Martin Plumbing, Heating, and Cooling, a mechanical contractor that works all over Missouri and as well as other states. Myself and my employees hold a total of 9 other state licensing in plumbing and mechanical. All those states have a similar pathway to licensing, and it's not easy, and I don't expect it to be easy, and I don't expect our licensing process to be easy. What I do like is that it sets the bar high. It sets a standard. And it also allows businesses to operate all over that state freely. So once you obtain your license, you can go city to city, county to county, pull a permit to do that project. Well, from my small town, we have to travel. So those states are much easier to work in. Missouri, I have to get a new license for myself and my employees if the ratio requires at every different city, every different county. I also have to obtain a performance bond for those as well. It's cumbersome, it's restrictive to growth, and it hurts my guys, my people, to try to be able to move forward. And then, so that's how it affects businesses and people in the state, tradespeople. The way it affects public health is if you were to leave here, go to get your hair cut, you're going to see a sign on their wall, and it's going to have a state license. They're going to be licensed by the state, and that's going to ensure that they've went through the necessary standards to take a test and deal with a state inspector. We currently do not have that for the quality of water that you drink in your home and the air you breathe. The jurisdictions certainly do have some, but there's a lot of the state that operates with zero mechanical oversight. That's a large concern for me, and I'd be open to take any questions.
Thank you, sir. Any questions for this witness? Seeing none, thank you very much for your testimony. Next up will be someone here that is in opposition. No opposition.
Thank you. I'll try to be as brief as I can. Raymond Hefner. I am a registered lobbyist on behalf of the Plumbing Industry Council, the Missouri Association of Plumbing, Heating, Cooling Contractors, and the Sheet Metal and Air Conditioning Contractors St. Louis chapter. We are here and been here for a number of times over the years. Just a couple of quick points. This licensing, as it's proposed, really doesn't help the 1 or 2 man shops. They're still going to require at least one person to have a license. It's not going to impact the bigger shops. The Murphy companies, the Corrigan companies, the people that work all over the country are going to require their persons to be licensed so that they can go into the jurisdictions that require that licensing to work. The state of Missouri doesn't want the federal government coming in and telling us what to do. Why does the state want to get involved in the local jurisdictions and tell them what to do when we have something that already works, in those jurisdictions? Portability in this licensing, I think that we can all agree portability is a great thing, but it just can't be contractor only. We would favor a portable license that would go jurisdiction to jurisdiction. We really aren't that far off with licensing if we can license at all levels and make it portable. We think that is important. Just one misconception I want to clear up when we talk about licensing on an individual level. It is an individual county to county. It's not a job to job license. I'd be happy to entertain any questions.
Thank you, sir, for your testimony. Yes, Representative Dinkins.
So what all falls under the mechanical contractor's license? You listed plumbing and...
So there are component pieces of this legislation that contain plumbing, specifically water heaters, backflow prevention devices, and gas-fired appliances, which are really governed under the plumbing code in the jurisdictions, none under the mechanical code. In order for us to support any kind of legislation, we'd have to pull those components out. The plumbing contractors that I represent in both groups, 98% of them hold mechanical licenses as well.
Okay, so I would agree with you that we don't need the state involved. And in my area, we don't have to have any kind of license, and our plumbing is doing well and our electrical is doing well. And I think less state involvement, like you said, would be the best. Thank you.
One clarification that I would like to make, it when you get into the larger jurisdictions, City of St. Louis County, those are complex, intertwined systems. We don't have a house sitting on a farm that's not going to impact another house sitting on a farm. We've got large subdivisions where an improper installation could impact the house next door. A large installation at BJC could impact all of BJC and businesses around BJC. So I just would draw that distinction and why individual licensing is so critical.
Okay, thank you.
Thank you.
Seeing no further questions, thank you for your testimony. Next up, in favor of.
Good morning. Thank you, committee members and Mr. Chairman. Happy belated birthday, I understand, is in order.
And just so everybody knows, I'm 59, not 57.
My name is Kelly Jones, and I'm the Executive Director of Gateway Air Conditioning Contractors. We're a trade association made up of more than 100 mechanical contractors, and I'm here in support of this bill. This bill is about licensing, and that's obvious, but what's not obvious is the burden that individual licensing puts on both small and large businesses alike. So basically, in a nutshell, there are two models of licensing. You've got a contractor model. One person gets the license and everyone works under that license. That's what we're trying to elevate to the statewide level. The second model is a contractor plus an individual license model. You still need a contractor license to pull permits, and then everyone on that job site has a license in his or her pocket to do the work. Now, in addition to that individual license, subcategories of licenses, sheet metal, pipe fitter, HVAC, just to name a few. So what do all of these individual licenses create? Inefficiencies. What the contractors do in the field, it's not easy. But how they have to navigate their business to just get into the field is unbelievably complicated. It astounds me that the opposition will boil this down to it's just simply taking a test. But what they're not telling you is that they've weaponized this test to keep competition out. Now let's get a little broader. Some of the largest population centers in our state have contractor licensing models or no licensing. Jefferson County, Kansas City, metro area, Osage Beach, and St. Charles County, to name a few. This bill supports what the majority of Missouri counties are already doing. Of the cities and counties with a population of more than 8,000, 69% currently work under a contractor model, and on the national front, HB 2050 supports what the majority of the country is already doing. 37 states have statewide licensing, and 63% of those have a contractor-only model. Working in the field shouldn't be easy. I'm not saying that. But it should be reasonable that someone can demonstrate their skills to their employer and then transfer those skills into the field. Please vote in support of HB 2050. Thank you.
Thank you for your testimony. I do have one question. I would like you to do me a favor and expand upon weaponizing.
Sure, happy to do so. So I've been in this job for more than 16 years. So I have seen a lot of changes. I refer to it as license creep, right? So it started out in one political subdivision, and it's kind of marched across our side of the state. When it comes to a contractor being able to put somebody into the field, in the counties, cities that I work with that have individual licensing, that person has to get qualified to take a test. Now, there is a lot of paperwork involved, documentation involved, and then what they need to do is put and submit that documentation to that decision-making body. That decision-making body meets once a month. All that paperwork has to be in 10 days prior to that meeting to get on the agenda for that month. So if you miss that 10-day window, boom, you're out another month. Then you have to get approved to take the test, and you have to wait for your credentials to be mailed to you to sign up to take the test. Once you get the mailing credentials, and trust me, I've had people wait months to get these these credentials mailed to them. Then you go on to the computer-based testing system, and you have to actually sign up to take the test. It's a 5-hour test. So when you're sitting and you're looking at this window of available dates, you have people who are in this national proctoring computer-based test situation who are maybe taking a 1-hour window test or a 2-hour window test. 5 hours is a hard get. So you're now waiting 4 weeks to schedule to take the test. So now you're at least 3 to 4 months out, and the contractors who are trying to just go to work can't put people who are very well qualified into the field because they are waiting on the whole testing procedure.
Okay, so is there anything where we could all come together that we could work around that specific issue, where getting people in to get their testing done could help us to get those folks licensed and then back out into the field?
I can't speak for the jurisdiction who has the testing, but I can tell you that they have had, just to get the updated test, right now they have an ordinance out there working under the 2015 codes. The test is still the 2009 codes because they haven't updated it yet. They're in the process of updating just the test itself that's been going on 1.5 years. I don't see this happening anytime soon, and we need people to go to work now. We know by the DOL we are like 150,000 HVAC-only technicians short.
Very good. Thank you for your testimony.
You're welcome.
Next up, in opposition.
Good morning, Mr. Chairman. Scott Ramshaw with the Plumbers and Pipefitters out of St. Louis, registered lobbyist. We're opposed to this legislation the way it's written right now. I know Kelly was up here making her statement, but we have tried to sit down and figure some of this stuff out. The last meeting we had a little over 1.5 years ago, Kelly was in the room, Bob Hoffman was in the room, John O'Mara, the business manager, asked, what can we do to all work together to try and bring this to a close? And Kelly specifically said, absolutely nothing. So that's kind of why we're at where we're at right now. We're open, our contractors are open to sit down and try and figure this out. To hear the lobbyists from the doctors, in the previous testimony, an educated workforce is important. St. Louis City, St. Louis County, they want you to know, you have to know how to install the system, build the system, maintain the system, and there's a lot to it, technology changes all the time. We work from residential homes up to nuclear powerhouses, so our workforce, just in St. Louis alone, across the state, we're a little over 7,000 UA plumbers and pipe fitters. St. Louis alone, we have 3,000. We're interviewing 30 individuals a month into our apprenticeship program. We brought in about 270 individuals last year, and we just initiated 50 new individuals last night. So at this point, we're opposed to the legislation. We are open to having some discussions. We tried to work it out with different lobbyists. It's just, we're not there yet, but I think we're working toward that point. But it's about an educated workforce across the state, and it's, having the right information and right training for those individuals. So with that, thank you.
Very good, thank you. Yes, Representative Dahl.
Yes.
Proceed.
So thank you for being here. And I understand your concerns. I have the same concerns. I don't think getting rid of licensure is a good thing. I guess my question is, can you speak to the previous comments about the difficulty of getting into taking the test? As someone with a lot of employees, is that an issue for you guys?
I can't tell you that part of it. I haven't looked into that. That's the first I've heard of that. I can check with our training department and get back to you. But
well, if you haven't heard of it, I'm guessing that must not be a huge issue.
Yeah, I don't know. I'm gonna go back and ask St. Louis County and ask our training department. I mean, we're for all workers, whether you're union or not. We just want the educated workforce and the ability for you to, like when we bring somebody in our local union, we bring you in for a career, for your career. We're not looking for one job, two jobs, three jobs. You're out. I mean, it's important. And minority participation is a big part of that. Women, African American, Asian, it's all across the board. We're about moving the construction industry forward in the mechanical systems and plumbing and HVAC. So,
Thank you.
Thank you. For anybody that was here last year, I'll just remind that was an issue that was brought up in testimony last year, was the frustration and the time frame that it took to get a license. And that's one of the reasons I wanted to expand upon the weaponizing. I think that is an issue, and I think that is a key issue that if we could pull together and work together on that could help us pull this whole thing together. So, Representative Grier.
To inquire.
Proceed.
Thank you, gentlemen, for being here. Just a couple of quick questions for
Thank
you.
you.
So, is the main concern with having something like this that the individual municipalities won't be able to create their own guidelines on what they feel is appropriate training and skill level to do the work? I mean, that sounds to be the main concern, right?
We're opposed to this legislation. We were the first legislation that Nick talked about, Representative Shore talked about a few years back when they did the electrical bill that was filed. It was for contractor portability. We were all in favor of a statewide contractor's license, similar to the electrical bill, that required a contractor, if he had met certain credentials, he could work across the state of Missouri without having to get that license. We were all in favor of that. The electrical
Main difference between
the electrical
that and this,
bill
yeah.
allowed for individual licensing in municipalities that already had it. We were okay with that. Mechanical contractors were okay with that. So, and then when we brought it to the attention, when the bill language got changed, we were told that our bill is to do away with individual licensing in first class, second class counties. So, I mean, there's a lot to it other than just coming up here talking about things you like or don't like.
And let me ask you another question. So the individual licenses in those municipalities, is there a wide degree of difference in what they're asking these folks to do, the type of training that they're asking for, even the testing requirements? Is there a lot of disparity between what these municipalities are asking for?
No, they're pretty much similar. One of the things that's really similar is that these tests are open book tests, and if you can't pass an open book test, it's 70% or 75%. I don't think you want that individual working in your building, your facility, your home, or a hospital. It's an open book test. Nobody talks about that.
Right. So the statewide requirements that are in this bill, elaborate on that.
Well, there's the statewide requirements really don't meet the requirements that are out there already in the industry. That's what we're kind of looking for. And we were hoping to sit down and try and figure out a path forward on that. So it's not, what St. Louis County has, believe it or not, Springfield has stronger requirements than St. Louis County.
Are you aware of any other states that currently have what the gentleman has proposed here?
No, there are other states that have licenses. Iowa does, Arkansas does.
That have, I guess, arguably less restriction around how the license process works. So there's a state license that has a minimum set of standards.
You got to remember about licensing. It's only as good as the enforcement. I don't think anybody over at professional registration knows anything about mechanical systems.
Yeah, I'm taking too long with my inquiry here. Where I was going with this was where I go with a lot of these licensing issues. Show me where there has been harm done to the public by something like this being implemented, and then I'll take a look at whether it makes sense, right? But until you can show me that in other areas that have this in place already, that make it easier for people to access the services that they want and people to work in that profession. We already have this essentially in rural areas. There are no regulations around them. This isn't going to require them to have people that are licensed, and we have not seen large degree of issues or problems or any that I'm aware of. So that's my only question. Thank you, gentlemen.
And just one statement, if you would reach out to the Fire Pressurized Safety Board, just over the last 10 years on pressurized vessels, hot water heaters, different types of things, there are 60,000 violations. It's an issue. Feel free
Where
to.
did those occur? Did those occur in the municipalities that do not require licenses, or the ones that do?
The majority of them are outstate, but I mean, feel free to contact that office and ask them to come over and give you a presentation. I know they only really come over when they're asked to come over, but the pressurized boiler safety department could give you an explanation of why what they feel about this bill.
Thank you, gentlemen.
Thank you.
Thank you, Representative. Thank you very much for your testimony, sir.
Yeah, thank you for your time. Have a great day.
You bet. Thank you. Next up is in favor of. How many more people do we have to testify? Oh, how many people are here from out of town? Okay, so I'm going to ask that we allow those who are here out of town to come up first. And if we could just, once again, keep our comments and our questions to a minimum. Go right ahead, sir. Thank you for being here.
Thank you, Mr. Chairman. Good morning, Mr. Chairman, members of the committee. My name is Mark Jackson. I'm the owner of All Air Systems Heating and Cooling. This year we celebrate 40 years of serving our customers' complete heating and cooling needs. I'm here today in support of passage of House Bill 2050. This morning I'd like to provide some context for the creation and the need to pass House Bill 2050. HB 2050 in large part mimics the current in-force successful statewide licensure bill for electrical contractors who currently provide safe, affordable services in a discipline of the highest and most complex order. We seek to replicate this model for mechanical contracting services. HB 2050 provides a contractor model affording a licensed mechanical contractor to perform their trade anywhere in the state of Missouri under the guidance of local permitting and inspection regulations. Municipal subdivisions without local regulations would not be subject to the act. In other words, business as usual in those municipalities that do not require licensure, permitting, or inspection. House Bill 2050 is the fourth time we've come to the State House requesting passage of a state law leveling the playing field to provide contractors a mechanism to deliver safe, affordable, pro-worker, pro-consumer, pro-small business mechanical services. The Missouri House passed this legislation in the last session. Thank you very much. Our fight actually goes back to 1999 when pro-union forces arrested control of mechanical contractor boards in St. Louis City and St. Louis County and attempted to build a code weaponized moat around those municipalities designed to eliminate unwanted competition, namely independent, family-owned, often multi-generational businesses. Today, those same forces are emboldened to carry the same playbook across the entire state of Missouri, guised under the false flag of public safety, which is merely a ruse for elimination of competition. At every turn where legitimate concerns from the opposition or interested parties have been raised, we have worked in person or through legislative language to accommodate reasonable change. You've already heard some of those changes that have been incorporated into the bill as we've moved forward. In the past, we've gone so far as to even propose mediation, which the opposition initially agreed to, but would never come to the table. Playing a waiting game of stalling and disinformation is intended to wear us down and eventually make us go away with one end-game intention: elimination of competition. Be assured, ladies and gentlemen, the only place we're intending to go is the governor's office to watch the legislation be signed into law. Thank you for time today, and I urge your support of House Bill 2050. If I may, I'd like to answer one observation that was provided by a representative of the plumbers and pipe fitters, specifically alluded to BJC and the complexity of those types of institutions. As I drove out here this morning, I drove Highway 70 in St. Charles County past a very, very large institution that says BJC Healthcare across the top. St. Charles County employs a contractor license, which is a model of the licensure that we're trying to pass on a statewide basis. And the last time I checked, they're operating very effectively in that county. Thank you very much for your time today. I'll take any questions.
Thank you. Seeing none, thank you very much for your testimony.
Thank you.
Next up in opposition to, anybody from out of town in opposition to. Go ahead, if there's anybody here in opposition to that is local, come on up.
Chairman David Winton here on behalf of the St. Louis County Executive and St. Louis County Council. Have a resolution in opposition to this language. St. Louis County has, as you have heard, has mechanical contractor licensing. We think it works well. We appreciate that, and we want to go on record in opposition to this.
Okay, thank you very much for your testimony. I apologize. We're trying to discover whether we can come back after a recess. And so if those who are here from out of town are able to stay until 1, we have the opportunity to recess until 1. For those that are here in town and I don't know how that affects your other schedules with other hearings, but if I were to take a vote of coming back at 1 o'clock, is my committee, first of all, able to make it back at 1 o'clock? Okay, so I've talked to our leadership team. They say we should be able to do that. Do I have anybody? I apologize. This happened to me last week too. So are we okay coming back at 1 o'clock? I'm going to keep going until 1:15 if I come back at 1 o'clock. If not, we're going to go really quick through each one of you, and we're going to try to get through here by 5 till. So help me understand what you guys feel you want to do. Keep going. All right, here we go. Next up is in favor of. Somebody from out of town in favor of.
Thank you, Mr. Chairman and members of the committee. My name is Tyler Menos. I am a second-generation HVAC contractor with Kirkwood Heating and Air Conditioning. I am here in support of House Bill 2050. As contractors, we are pro-safety, both in our industry and in our communities. And the only way to ensure public safety when mechanical equipment is installed is with a final inspection. How this works is a licensed contractor must pay for a permit, which then triggers that final inspection to ensure the work is done properly, safely, and up to code. So again, to trigger that inspection and verify public safety, you must first be a licensed contractor. Currently, burdensome licensing laws are driving work underground and uninspected. By our last count, if you wanted to perform mechanical work across Missouri, you would need at least 37 different mechanical licenses, all with different requirements, structure, and almost zero reciprocity. We're proposing deregulation by removing the obstacles of licensure, which will allow contractors to pull permits and get inspections on their work. We want to elevate Missouri to the same standards many other states use with common sense licensing to end the duplicative and inefficient piecemeal licensing structure we currently use. In creating an optional and voluntary state contractor license, authority will still remain within each political subdivision through their ordinance. So,
Sir, I apologize. Can you please make sure that your mic is on?
Maybe I'm not close enough. Sorry. Hopefully you caught bits and pieces of that anyhow. But again, if no licensure exists within a political subdivision, like in many rural areas, this will not force those places to adopt this state license. It is simply a tool which will allow contractors to work across the state freely if they choose. We're not asking to rewrite current codes, but rather use the existing code to define mechanical work. And more stringent work like the installation of medical gas systems, backflow preventers, which are in the mechanical code, or even nuclear equipment, they'll still require additional certifications, even with the state mechanical license. So business can continue tomorrow just as it does today. With this bill, no additional licenses are created. It will all fall under one streamlined license. I go back to the 37 licenses. Imagine driving across this state and needing 37 driver's licenses to go from jurisdiction to jurisdiction. You don't forfeit your experience and knowledge and expertise by crossing these invisible boundaries. Thank you.
Thank you for your testimony. Any questions? Quickly, not seeing none. Thank you for your testimony and for being here, sir. Next up, in opposition to.
Mr. Chair, members of the committee, Will Mars from the City of Springfield, registered lobbyist. Just want to go on record in opposition. I think we always get drawn into this issue every once in a while.
Can you do me a favor and either check to make sure your mic is on or come closer?
Sure.
There you go.
So we always get drawn into this issue at some point because we always have a pretty high standard. Our contractors are very happy with it. We hear about it a lot. So I really think that there are multiple solutions to this, and I'm happy to work with the sponsor on it. So far, some of the other groups just haven't come to that agreement yet. So happy to answer any questions.
Thank you, sir. Seeing no questions, thank you for your testimony. Up next is, where did we leave off? In favor of.
Good morning. My name is Zachary Peters. I'm a third-generation owner of Peters Heating and Air Conditioning. We have 8 locations, 4 across Illinois, 4 across Missouri, with a workforce of 250 employees, and our company has been around for 68 years. The first gentleman supporting, in opposition to this bill, talked about public safety. Quintessentially, as we testify here in this building, there is 0 licensing requirements to service or work in this building for a mechanical contractor. With the protectionism in place today regarding licensing in cities, counties, and municipalities in the state of Missouri makes utilizing our full workforce in Missouri almost impossible. I am licensed in Columbia as master mechanical. For me to go to St. Louis, I have to take their test, take their continuing education, as well as any employee that I send over there to install. Yet I could send 10 service techs to St. Louis County, and they can work without licensing. With the licensing the way it is now, if our shop in Columbia slows down, we cannot send guys to our Troy location, or vice versa. Hannibal can't send guys to Columbia. Hannibal can't send to Troy to service the St. Louis area. I work in Kansas, work in Illinois, we work in Iowa. Licensing in certain jurisdictions are very much similar to St. Louis. Other jurisdictions are 1 mechanical license, anybody can work under it. We have some guys that maintain 7 to 9 different licenses for our company in 1 location. Not only do we pay for their time, we pay for their test, we pay for their education, and we pay for their continuing education, which is required to keep those licenses. When I hire somebody to come to my house and do service, I make sure that company is licensed, insured, and bonded. I don't ask them if their employee is licensed, insured, and bonded. We as business owners take that responsibility of putting an educated person on that project. The employee that is licensed does not take that liability. We as business owners do. As the gentleman said before, coming from Columbia to St. Louis to Kansas City, our knowledge, our employees' knowledge, does not stop at a boundary. It continues on and on. And as business owners, we want to make sure our reputation, our employees, stay intact. And with all the licensing stuff, we cannot make that happen.
Thank you for your testimony, sir. Are there any questions for this witness? Seeing none, thank you very much. We appreciate you being here. Next up, in opposition to. The floor is yours.
Hey, good morning, Mr. Chairman. Good morning, representatives. I'm David Klarich, and I am appearing today in opposition to House Bill 2050 on behalf of the Mechanical Contractors Associations of Eastern Missouri and Kansas City. I represent the employers, and I want to say that you've heard a lot of information with respect to those who are in favor of this legislation that perhaps is more their desire and intention than it is reflected in the legislation that's before you. By way of brief overview, I'd like to just bring your attention, 7 years ago, legislation was introduced and passed. Senator Schatz was its primary sponsor relating to the electricians, and that created a statewide electricians contractor model. That legislation was then introduced in the form of a mechanical contractor license 6 years ago by Representative Kirk Matthews from Southwest St. Louis County. we, in fact, at that time testified in favor of that legislation because it did exactly what it is that many of the people who have just testified in favor of this legislation and say that they want this legislation, that was actually the model that we wanted to embrace, one that everybody in this room can support. But for the last 5 years, it's taken an ugly turn. And the reason why you've had this before you for so many years is the fact that this legislation does not do what you've been told. In fact, does two things. It creates a statewide contractor model, but it also eliminates individual municipal political subdivision oversight of the trades. That's not something that is in anybody's best interest. So let me just be clear. The legislation that we have proposed and have offered up to the proponents would give them 75% of what they want, but it does not eliminate the oversight and educational requirements for public safety purposes of those political subdivisions. We find that to be the wrong direction as a matter of public policy. I'd like to encourage you to take a look, if you will, please, at 324.959.3, which is page 4 of the legislation, lines 34, starting at lines 34. That's the section that says if you have a statewide mechanical contractor under this bill, you only need one. Now, I mentioned originally that I have large employers. One is McCarthy, 13th largest mechanical contractor in the United States, thousands of employees. Can you imagine McCarthy having one license? And everybody that's under their employ, according to this bill, is deemed to be qualified. I would differ with Kelly Jones' assertion that there are a lot of people that are qualified. How would she know unless they have been educated? You wouldn't. And then I would contrast that page, page 4, paragraph 3, to page 5, paragraph 1, which says municipalities have to recognize that license in lieu of everything else. That means there's no oversight. That conflict is going to be an impasse. Not only should it be an impasse here, but it will be an impasse on the other side of this building. We stand ready and willing to work with the other side. We have always been at the table. We have never denied any option. But let me also say, just in conclusion, Mr. Chairman, and I apologize, but I want to say in conclusion that it is a misrepresentation to say that that this legislation has changed in the last 5 years. I would be hard pressed, and if you would please point out over the last 5 years how this is substantively different. We are willing to make those changes, and we'd appreciate your help. Thank you, Mr. Chairman.
Thank you, sir. I'm going to make a statement back to you, if you don't mind.
Oh, okay.
The idea that every single municipality should have their own guidelines, in my opinion, I'm going to give you my opinion right now, is absurd, because it's not that big of a difference going from St. Louis to Kansas City to Springfield to, there shouldn't be different testing requirements or different regulations as to what happens in those municipalities. I am a financial advisor, as many of you know. I have one license for the whole state, and I have to take continuing education. I'm not necessarily opposed to having the people licensed that do the work, but I don't think that they should have a license for every single municipality across the state. That doesn't make sense to me.
Mr. Chairman, you are absolutely correct. In fact, it is your position just stated that is the position that I and the associations that I represent maintain. Exactly.
Okay, but I just want to clarify, because I thought I heard you say that it should be the local municipalities' position to make those educational requirements and the licensing requirements.
Thank you for allowing me to clarify, because that's not what I'm saying. Okay. What I'm saying is that we believe in the ability to take what we refer to as portability, allowing a contractor license individual by individual. So if one of these gentlemen behind me or ladies behind me that does this type of work wants to go and avoid all the individual political subdivision licensure that is available in the state, they should just get one of these statewide mechanical contractor licenses. That's what we want. Springfield just testified. Springfield has the highest educational standard in the state. St. Louis is second there too. What we have offered, Mr. Chairman, is the ability to have that license that you want. We will address the situation and have addressed the situation that they've addressed trying to avoid each political subdivision's burdensome regulation. We don't want that either. It affects our business. We don't want it. We want exactly what you just said, Mr. Chairman. Thank you. And I believe that you would be supportive of our legislation.
Very good. I appreciate your time and your testimony. Thank you very much. Any questions? Seeing none, thank you for your testimony. Next up is in favor of.
Thank you, Chairman. Chairman Coleman, happy birthday again. My name's Corey Malone, second generation owner of Air Comfort Service in St. Louis, been in business for 53 years. And when I sign my name to this as being truthful, I take it seriously. I'm going to be very quick so we don't replicate. Ultimately, at the last line of defense for the homeowner or business owner or whomever is the local code official. Permits, if they're required, will be pulled. That is where the last line of defense is. It doesn't matter if you can pass a test, whatever the case is. If it's not to code, it has to be redone, and that's the way it is. There's no reciprocity for licenses. That's already been talked about. One thing that is really disappointing is I interviewed a guy 2 years ago, and he was in the Air Force. He was in the Air Force for 10 years, worked on very, very large, complicated systems. And we offered him a job and told him that he would have to be an apprentice, making less wages, and that it was going to take maybe 3 to 4 months to get his opportunity for him to take a test. And he's like, the heck with you, the heck with St. Louis County, and he moved out state. So we're losing a lot of qualified workers because we can't put them to work right away. Just a quick anecdote. I hold the master water heater license for my company. And the night I took the test, we were told it's just an open book test. Well, take that for what it's worth. When I was on my way home, I got a phone call on my cell phone by the proctor of the test, and she was ecstatic. And I was surprised. I go, what's going on? She goes, you're the only one that's ever got 100% on the test. I go, I got everything right? She goes, well, no, because there's 3 or 4 questions in there that we just threw in there just to trick people up. So you'll never get 100%. We've had committees go through the St. Louis County test and some other tests that the municipalities want to do. And there's multiple, upwards in the teens of questions that have no answers to them, or the answers are incorrect. And there's nowhere to find it in the book. So flawed testing, the municipality that's the biggest challenge right now that is opposed to this, it takes 6 months to get your renewal in the mail, and you mail it back in with a check, and it's another few months before you get your license. So it's just a bureaucracy that is insane.
Very good. Thank you very much for your testimony, sir. Any questions? Seeing none, thank you very much. As you can tell, we are getting close to our session that starts at 10, so we'll continue on until 5 till, and then we'll come to a conclusion. For those who are here, once again, in opposition, can you raise your hands? Seeing none, good. For those who drove here that are here in favor of, please come up. I guess you all drove here, huh?
Hi.
From out of town.
My name is Robert Hoffman. I'm a mechanical engineer, have my professional engineer's license, own a company called Hoffman Brothers in St. Louis with over 300 employees. And just to correct some of the statements, the gentleman over here was talking about McCarthy, the largest mechanical contractor. He's a general contractor. McCarthy doesn't have any pipe fitters or plumbers, and there's no licensing required in the general contracting industry. And also, our bill has never changed. It's always been a contractor license. It was a contractor license on day one. It was modeled strictly after the electrical license, which is a contractor license. That's another misstatement that was said by some of the opposition. The electrical license is a contractor license. But the main reason why I'm here is to tell you how they weaponize licensing. The real reason behind why they don't want to get away, or why they want to keep the licensing model they have. So we've talked about, so first of all, they create a licensing board. This licensing board is full of union officials and union contractors. And as a non-union person going up in front of them, it is very tough. I mean, the paperwork you have to present to them to get approved for the test. Then it goes in, then if you get approved for the test currently has a 50% pass rate. So imagine these are guys who went to school, went to a trade school, spent tens of thousands of dollars, worked 4 to 5 years in an apprenticeship program, and they have a 50% pass rate. It was less than 30% for 2 years, 30%. I've seen grown men cry. They spend, years and tens of thousands of dollars to get into this trade, and they have to leave. Because of this testing. The testing is the wrong test. They give you a test for an engineer, not the test how to design the stuff. They don't give you a test on how to actually do the work. They talk public safety, how, there's this big public safety crowd. I mean, that's just a ruse, hiding behind their weaponization and intimidation. The other thing, the reason why you don't want individual licensing makes the contact information of all your employees public record. And they've used it for recruiting. I've actually gone back and found the sunshine request for all my employees. They all received nasty letters about me, about the company. They follow my employees to their homes. They go to their homes in the morning when they wake up and they drive to work. They follow them to work. They follow them into McDonald's. They harass and intimidate, and they use individual licensing to do that. Do not allow individual licensing. You will be allowing the weaponization of licensing to spread across the state of Missouri. So I encourage you to pass this contractor licensing model, because contractor licensing allows free and open competition, and it doesn't allow the weaponization of licensing. So that's the true reason why they're opposed to it. They've told us this in the past, so I just want to encourage you to support this bill. Thank you.
Thank you for your testimony. We are going to move on to the next witness because we have like 5 minutes left.
Thank you, Mr. Chairman and members of the committee. My name is Brian Agers, and I own Agers Heating and Air Conditioning, and I'm also president of the Contractors Association called Gateway Air Conditioning Contractors. And so just to give you an idea of where our members stand, we polled our members back in October, and we asked the entire group of contractors present at the meeting, who is in favor of this model of licensing we're going after, who's opposed? And the audience answered with a 93% in favor of this model of licensing. So some things that I want to clear up. 35 states currently have some form of contractor model or some sort of state license. The vast majority is contractor model. What we are proposing is optional. That means that people that work in your district, Representative Dinkins, don't have to get this license. It's an option. And so in St. Louis County, for instance, we're not saying that the county has to change their code. They don't have to change their permitting process, their inspections. What we're simply saying is if we've met the credentials to have a statewide license, then we should be able to have a seat at the table to pull a permit, do the work, and then have that work inspected to whatever the code is that St. Louis County is requiring. That's pretty much in a nutshell what this bill does. It does not do many of the other things that I've heard testified from the other side. And this easy open book that we're talking about, it's 6 to 9 books, depending upon the test that you're taking. It's 150 questions, and 5 hours gives you 2 minutes per question. So you've got to find the answer in your 6 to 9 books. Many of those books have no table of contents. And I've watched grown men who have come from other parts of the country who are well qualified, who are not good test takers, fail that test. At the low point, St. Louis County's pass rate was in the teens. It averaged around 30 before they changed the test. Now that we have the new and improved test, it's 50% pass rate. So the people taking the test didn't change, the test changed. And that's why the pass rate has improved. But it's still fraught with questions that don't have a correct answer. So, I just wanted to end with, there's a lot of misinformation being pushed by the opposition, and there's a lot of lies about how we're unwilling to meet. We tried to get them to come to a professional mediation over the last break, and we couldn't even get a response from them. So this narrative that we won't talk, that we won't agree, it's a lie.
Thank you very much. Appreciate your testimony. Next up for testimony in favor of. And sorry, folks, is there anybody else here that drove in from out of town that is here to testify? So we have one other person, so we could squeeze it real quick because we've got to be up in about 5 minutes.
Yes.
That's 5 minutes upstairs, so.
Got you.
Thank you.
Good morning. Thank you, Mr. Chairman. I'm Travis Rackers. I live here outside of Jeff City. I'm third generation HVAC company owner. We've been in business since, my grandfather started business in 1934. I've been doing HVAC work since 1995. Have, in that time, doing work in Cole County, Jeff City primarily, never been required to take a test or be licensed individually. So, as stated before, I could work in this Capitol building without a license. I just to keep it short, basically wanted to recommend that you all pass this HB 2050 for a lot of the reasons that have already been discussed. So, thank you.
Very good. We appreciate your testimony. Yeah. Thank you very much. And yes. And you're next. Come on up. So we're ready to go as soon as he's done. Thank you.
My name is Mike Keevan. I run a second generation HVAC company. A lot of my statements have been already said here. So the one thing I am going to say is a comment was made that Springfield area has the strictest licensing requirements. They do have a very strict licensing requirements. However, the difference is in St. Louis County, for every journeyman that I have on the job, I can only have one apprentice. In Springfield area, for every journeyman I have on the job, I can have unlimited apprentices. So my workforce is diminished in St. Louis.
Thank you very much. We appreciate your testimony.
Good morning. My name is Heather Coyle. I am the Government Affairs Director for Associated Builders and Contractors, Heart of America chapter. We are a trade association that composes over 270 contractors and construction-related firms in Missouri and Kansas. I wanted to go on record in support of the bill. And I also just wanted to say that we do have members that have communicated to me that they are unable to do work sometimes in the jurisdiction in which their business is located due to the requirements that are currently in place for mechanical contractors. Thank you.
Very good. Thank you for your testimony. Anyone else here that would like to testify before we leave? Thank you very much. That concludes our hearing on House Bill 2050, and this meeting is adjourned.